Thank you very much. Good morning. Um, my name is Andreea. I'm originally from Romania. First of all, I'll take 30 seconds to express my gratitude. And thank you very much for having me here. Giving my background and the nature of my work, I don't think I've ever imagined myself ending up in such a setting. And it was a very nice surprise. I learned a lot. So I'm here basically to learn from you. I'm not sure what I can enlighten you about. So just a quick question. Am I supposed to see something here on the screen? No. Okay, great. I also represent a European Board for Certified Counselors, and some of you yesterday met Dr. Scott Hinkle. He is my colleague from the United States, from NBCC, National Board for Certified Counselors. Also, I have my colleague, Dr. Wendy Schweiger here. She made this possible for us. What I will talk today about is the same program that Scott Hinkle presented yesterday, and I'm a little bit, let's say, I'm less privileged because I'm coming after him, and that's always, let's say, a challenge. But I would start by telling you that this is a program that in the beginning, I didn't believe in. My background is education, a little bit of business, coaching, and coming from Europe and seeing the program the way it looked back in 2006 when it was first piloted in Mexico. My opinion was that it is too clinical for Europe, and Europe is pretty much well covered when it comes to mental health needs. So again, this is the second surprise for me, being here and actually believing in the program as it looks now, today. And I will tell you a few things about how this program is shaped now in Europe. As I mentioned to you, we all represent this company called National Board for Certified Counselors. We're counselors, so we're one of the helping professions, and with the headquarters in North Carolina, in Greensboro. NBCC International is a division of NBCC. It was created almost 10 years ago. It's represented by Dr. Wendy Schweiger, and it was created as a response to the countries that wanted support in order to build their own counseling profession. So it was a reaction to various countries that were asking support in this direction. Under the umbrella of NBCC International, the program that I'm talking about, the MHF Mental Health Facilitator, was born. And as it was explained to some of you, the curriculum trains lay people, paraprofessionals, outside of the regular or the traditional mental health professionals in fundamental skills associated with attending, mental health needs, referral, and advocacy. The most important thing when it comes to the way it's shaped is that this program is not intended to train a new category, a new profession, mental health profession at all. It's just a training that is targeting those basic skills. And there is no marketing, there is no promotion, there is no budget in order to spread it, over the globe. However, we have it present in 20 plus countries right now. One of very important aspects related to this program is that there is no stigma attached, and that's not what we say. This is the feedback that came from our colleagues working with us in this program. They perceive it as being non-threatening, not necessary. It's not therapy, it's not medication, it's not diagnosis, is simply is not threatening to the public. Now, going to Europe, I was trying to use less words in the slides and look for relevant pictures. And I decided that I was thinking that as Einstein is recognized across the globe when it comes to science, Well, I think everybody recognizes Freud. So Europeans say, not me, I'm an education person, but Europeans say that therapy and mental health professions were born in Europe. So whoever else is doing that right now in the United States, Asia, or in other parts of the globe, basically, they just follow the Europeans, speaking about big egos and mental health needs. So what I'm trying to say is that mental health professions are pretty well established there. So they tend to be very territorial. And I understand that we have the situation in other parts of the globe. I personally represent European Board for Certified Counselors, the headquarters located in Lisbon, Portugal, and we're trying to support the European countries they're in their way to build a counseling profession. And because of that, we, through EBCC, we introduced a program related to career development, simply because of the market needs, the economical needs there. As I mentioned before, the mental health needs are supposedly met, but due to economical struggles, it was at some point a huge need for career-related interventions. So this career development program was implemented in 2003, and the surprise was that after 5 or 6 years, our former students came back to their educators and said, we run into some issues we're not trained for, like my client starts to cry in the session, what am I supposed to do? And we realized that that program, the career development program, like taken out from the context of everything else, was not sufficient to meet the unemployed or even the employed people's needs. They were looking for career development. So the way the MHF program was introduced in Europe was really different than in other parts of the world. It was a surprising way. Now the program, we have people trained as MHF trainers in Bulgaria, Cyprus, Germany, Greece, Hungary, Macedonia, Portugal, Romania. And I will let you, this is a 50-second movie. What I'm trying to do is, maybe you can help me to, thank you. And this comes from Romania. And that tells you what the situation is.
As Executive Director of NBCC Romania, I find that implementing the MHF program in Romania benefits several communities with various needs. To mention just a few of them, teachers can use the helping skills in improving their relationship with pupils and parents, but also in the early detection of mental health challenges. Managers learn how to handle emotional reactions in various crises that can happen in organizational settings. Other professionals working with people, such as physicians, nurses, priests, career consultants, develop skills that help them identify, refer, and in some cases provide primary support for people with mental health needs in their communities. One of the wonderful things about the MHF program is that its curriculum manages to concentrate in a very comprehensive, professional, but practical way the essence of helping in the area of mental health, so that primary support can be provided to populations in various settings.
Okay, and just to finalize this, I see I'm out of time here. The surprising support came from the president of the university that is hosting NBCC Romania, and he's a professor of law. And he thinks that the future physicians in his universities need to be trained, need to have this training. And he also mentioned the lawyers, the mediators. He actually wants his students to be trained in MHF. And that's, again, a surprise for us. So just to conclude, these are the professional areas which are requested which request this program. As you can see, we're not talking about basic needs. We're not talking necessarily about AIDS or something else. Thank you very much. And if you have any question, I'm here to answer. And you have some flyers for our program waiting for you. Thank you, Megan.